Otherwise, Sam, I invite you back again to give us the next very interesting presentation. Back to
Thank
you.
you. Thanks. Yeah, so our very broad approach to the Zero Waste Theatres project brought into focus the need for a radical look at the way the Trust approached waste management. And to facilitate that transition to a circular economy, we really needed to look at how we segregate, collect, and treat the waste we produce. With the current waste management contract arrangements were coming to an end, it was a real opportunity for us to further adopt the innovation procurement methodology to help us achieve that shift, with the establishment of this new project to deliver sustainable waste management. And next. So this procurement opportunity was also the moment to extend the project to cover two big hospital trusts in the Bristol area, essentially doubling the size of the project. We're very aligned across the two trusts in terms of our sustainability targets, and we're working closely together. So it was a really good opportunity to increase the size. Next. And we'd been contracting through a national procurement framework, which we'd used for many years and had been just sort of continually being renewed, but it really wasn't meeting our national carbon reduction targets or the Trust's really ambitious sustainability targets. So we knew we needed to do something different. Also, historically, the waste management supply chain has been very resistant to innovation and been dominated by a small number of very large suppliers who really control the market. So we worked together across the trusts to really define our shared unmet need, which we worked out was we need to transform our healthcare waste services towards progressively more environmentally sustainable waste management and reduction services in support of the Trust's sustainability and net zero targets. Next. And we set out our aim, which was to transform our waste management services to reduce that volume of waste generated, reduce the carbon emissions to net zero, and enable the change to a circular economy in a transparent way. Next. So we identified the problems with the existing approach. There was lots of waste going to landfill. Waste was being transported long distances. There was lack of monitoring and transparency. We didn't really know what was going on with the waste. And the paying for the disposal of waste by volume really doesn't incentivize reducing volumes or circularity. In fact, it encourages bigger volumes. The poor segregation of waste, particularly the clinical and recyclable waste, have a really high environmental and financial costs by getting into the wrong waste streams. Next. So understanding those problems really helped us think about what the outcomes were that we were looking to achieve. We wanted to reduce waste volumes, improving segregation of waste, achieving zero waste to landfill and zero waste exported to other countries, absolutely minimizing incineration but beyond what we had to do for compliance, and reducing the transport of wastes. Next slide. So we produced a joint statement of demand, which we shared with other hospital trusts in the UK and Healthcare Without Harm for to get views across Europe. It was a really great process, and it was very clear from that sharing the statement of demand that there was a real consensus that there was a need for change in the waste management services. And it really showed that there was a strong demand and a need for change. Next slide. We went into the market consultation phase, which was really good. We got 30 responses, of which 60% were the SMEs. The information we got out of this was absolutely invaluable. Really opened up our eyes as to what was possible. The market did have solutions that could contribute to achieving our outcomes of what we wanted. And also, it did reveal that the NHS procurement processes that we traditionally used really limited new solutions and innovation and stopped SMEs from competing in tenders. Next. And so what did it tell us? Well, it told us that we couldn't do everything on day one. You know, we had some real ambitious things, and that it would take time, that we'd need to have progressive improvements over the term of the contract. We learned that the length of the contract was important in how it could support innovation and investment. We learned about what SMEs could offer and the challenges they face, particularly in accessing tendering process. We learnt where suppliers could help with our net zero target most, and also where they really were less able to help. And we explored the challenge of actually specifying waste reduction within the tender, and how that could be a challenge for some of the suppliers. Next. So our pro-innovation procurement steps, actually getting a agreed procurement strategy was quite a difficult step, but this really did lead to lasting change, including a new requirement within our trusts for procurement projects to have an agreed procurement strategy, which is a really significant change in how our organisation has worked. That not taking the easy route of just going to national frameworks was a big shift for our purchasing teams, doing things really differently, and applying the insights we gained from the market feedback and the need for innovation. That had to be balanced with other concerns and perceived risks. So there was a lot of delicate exercise we had to go through for this step. Next. So we're adopting a pro-innovation approaches meant we were definitely doing things really differently. We're taking an outcomes-based approach and embedding sustainability, carbon and waste reduction, improving air quality into the tender documents and through the whole process. And using award criteria that had balancing the price with operational and sustainability outcomes. So these approaches were a real significant change, but we've learned a huge amount, and we're now applying those approaches and principles in other procurement exercises. Next. There were lots of challenges along the way. Here are some of them. But I think, yeah, a really big one is introducing new ways of working. Certainly is hard in large and complex operationally critical services. And also the challenge of having a pricing methodology that incentivizes waste reduction. We haven't managed to achieve that yet, but we have managed to get build a way of having progressive improvement through collaborative contract management that's been built into the tender. So we've learned a way to do it without completely shifting things. Next. One of the strategic decisions that came out of the market engagement process was the opportunity to make an immediate transition to reusable sharps bins. So we will no longer be sending plastic bins with needles to be incinerated. To implement this, it hasn't been simple. We've had to get our clinical staff and our infection control teams to support this new approach to a way of working, but it's going to give us significant benefits in reducing the single-use plastics and carbon emissions. To achieve 48,000 plastic bins being saved, a 30% reduction in waste, and an 88% reduction in carbon. So a really significant impact. And next. So despite the challenges, the tender is in progress for sustainable waste management services across both trusts. And we are in the midst of it at the moment, evaluating the responses. And it's really interesting to see what the market is coming back with. That pro-innovation approach has resulted in sustainability being embedded throughout the tender documents, the evaluation criteria, the key performance indicators, and really importantly, the contract management mechanisms. There's the commitments that the suppliers are making in those tender responses will form part of the net zero and social value management plan for the contract. And that's being converted into the commitments with it, which we'll be able to monitor through the contract. Next. So, in conclusion, the pro-innovation procurement approach has enabled the trusts to challenge the status quo and take really positive steps towards a more transparent, sustainable, and lower carbon waste management solutions and service delivery. The learning that we've had made in this project has had a real impact, including on the national picture. We know that it's influencing other waste tenders and frameworks that have learned from our experience. And it's had a lasting impact in changing procurement processes, including that requirement to have an agreed procurement strategy, and the importance of market engagement, particularly with SMEs, taking a much more prominent role. There's been an increased awareness of how procurement can be used to achieve our strategic objectives and better outcomes, rather than simply being reduced to a financial transaction. So we are really making steps towards that, achieving carbon reduction and circularity. And it's set us on that journey towards zero waste, net zero carbon waste management, and achieving the Trust's ambitious commitments. And importantly, it's really empowered the sustainability team with the knowledge of pro-innovation approaches, enabling them to challenge the status quo of procurement. So we're really starting to close that gap between policy and procurement action. And I want to really thank the EcoQUIP team for this transformation that's been for me and for my wider team. Thank you.